Nisar. Good evening, good afternoon, and good morning. This is the 1091st day of continuous webinar from International Forum for Promoting Homeopathy. Today, our guest is Dr. Shwetha Singh, MD, Homeopathy, and PhD scholar. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, every day we are conducting webinars since last 1090 days, and today is our 1091st day of continuous webinar. And every day we have a guest, or the guest is always presenting wonderful papers, subjects every day. But today, Dr. Shwetha Singh, MD, PhD scholar, is one of the best person to talk about one of the best subjects, alcoholism and its homeopathic management. Let me introduce Dr. Shwetha Singh to the forum. As everybody knows her, but let me share her details here. She is working as a senior research fellow in Central Council for Homeopathy headquarters in New Delhi, and she is a senior consultant, Orbit Clinic. She brings with her a rich experiences of more than 10 years of and expertise in treating many difficult cases. She graduated in BHMS from Baxter Homeopathic Medical College Hospital, Delhi, and completed her MD in homeopathy from Sri Guru Nanak Dev Homeopathic Medical College and Hospital, Ludhiana. She had also completed a postgraduate diploma in health promotion and National Institute of Health and Family Welfare, New Delhi, and currently she is pursuing PhD in homeopathy from reputed university. She is president of Delhi Homeopathic Medical Association and became the first female president of this association, which was founded in 1032 by Dr. Yadav Singh, first health minister. She is also chief administrator of KHA Homeopathy Study Group, USA, chief editor of the annual newsletter Exploring Homeopathy, an initiative by Orbit Clinics. She is also the chief editor of Handymanian Homeopathic Sandesh, an online peer-reviewed journal by Delhi Homeopathic Medical Association. And she is also an associate editor of the Homeopathic Heritage by B. Jain. She has also worked as medical officer at Mukesh Foundation in the field of drug de-addiction. She also worked in the post of assistant professor in the Department of Organon of Medicine and Homeopathy Philosophy in a reputed medical college. She is a recipient of many awards, and she has been awarded the legendary homeopathic award from the Health Minister of Uttarakhand, Sri Dhan Singh Rawat, on 21st August 2022 in the first National Homeopathy Conference in Uttarakhand, and KHA Handymanian Award in May 2023. With all, let us invite Dr. Shwetha Singh to this forum to present alcoholism and its homeopathic management. As you all know, that alcohol is one of the biggest challenge to the nation, and we can manage alcoholism with homeopathic medicines. And let us invite Dr. Shwetha Singh. Oh, welcome, doctor.
Thank you so much, Dr. Danish, and I thank the team of IFPH for inviting me here, especially Dr. M.K. Sahani sir, for giving me this opportunity to share my little experience with all of you, all the esteemed viewers. Shall we start, sir? Shall I share my presentation?
Yeah, you can.
Yes.
Is it visible to what?
Yeah, visible.
So we will discuss today alcoholism and its homeopathic management. Nowadays, you all know that psychoactive substance use is so common in the society, and in which alcohol is exceeding the race. It is the most common psychoactive substance that is used by a lot of population. The reason could be it is legally available or easily accessible substance. Now, it is important to know that the epidemiology, according to WHO, 380 million people are affected worldwide. That means 5.1% of the total population are affected with these substance use disorders. And in India, if we talk about in the world, 7 crore 87 lakhs people are dependent and addicted to these substances, whether it is alcohol, cannabis, opioid products, hallucinogens, sedatives, etc. And they need immediate treatment. If we talk about the current prevalence rate of these substances, alcohol is top the list. Then cannabis, the second most common substance use drug, then opioids, then heroin, and then inhalants, solutions. In India, in a survey, alcohol use was found 14.6%. Between the age of 10 to 75 years, 14.6% of the population are the users. 5.7 crore people are using it in a harmful way, and 2.9 crore people are dependent on alcohol. That means 2.7% of the population is dependent on alcohol. They are abusing alcohol and they are suffering with alcohol use disorder. They need immediate treatment. It is important to diagnose when we will say that a person is just using alcohol, or he or she is alcohol dependent, or they are using in harmful way. So basically, when a person, usually there are three categories. What is alcohol use? When a person uses alcohol in a party occasionally, they're not regular drinkers, and they're using alcohol with no negative consequences, then we will say there are no adverse effects. Then we can say that the person is using alcohol. But when a person is in a pattern of alcohol use, which results into physical and psychological effects, they are using alcohol in a pattern that cause damage to the health. And in spite of that damage, the person is regularly using and continuing with the alcohol. They are in this phase, they are not dependent, but they are using it in a harmful way. Then we can say that the person is in a harmful use, using alcohol in harmful use. When we will say that the person is abusing it, or the person is dependent on it, and he is diagnosed as a alcohol use disorder. When a person uses alcohol in a pattern that, apart from the physical and psychological effects, they are having social, legal, and occupational harms. That is known as when the alcohol is affecting not only the physical and mental health, but it is affecting every sphere around the person. Like, there's disturbance in the relationships, interpersonal relationships. There are disturbance at the workplace. There are disturbance at the school place. There are legal penalties or legal disturbances are there. Then we will say that the patient is alcohol dependent. The term which was used previously was alcohol dependence. Now in DSM-5, the term used for these patients is alcohol use disorder. Then The states where basically alcohol use is highest prevalence are Chhattisgarh, Tripura, Punjab, Goa, Arunachal Pradesh. And the definition of alcohol use disorder is defined by a cluster of behavioral and physical symptoms, which can include withdrawal symptoms. We will talk about the withdrawal symptoms later, that develop approximately 6 to 12 hours after the reduction of intake following prolonged heavy alcohol ingestion. Now it's clear what is alcohol use disorder. There are ways with which we can diagnose this disorder. First is, there are 4 categories. First is impaired control. What is impaired control? When a person loses control over alcohol use behavior, that got impaired. Basically, when a person use alcohol, they demand it in larger amount over a period of time. That was intended. There is strong craving, strong desire to use alcohol. There is persistent desire, or the patient is have unsuccessful efforts to cut down or control the alcohol use. The patients spend more time to just obtain alcohol, to use alcohol, and to recover from the side effects of alcohol. So this is basically impaired control. Then social impairment will be there. The patient is basically, he is just spend time in those activities to obtain alcohol or to use alcohol or to recover from the side effects. Then they will fail to fulfill their major role obligations. They won't go to school. They will miss the important functions in a family. They will miss their workplace. They use it continuously despite having persistent and recurrent social or interpersonal problems. They will miss the social, occupational, or recreational activities. They will give up. They will stop participating in all these activities. Then the risky use. The patient will have the physical problems or the psychological problems, but the patient is continuing the use of alcohol. Then there is pharmacological criteria, where there will be tolerance. There is withdrawal. The patient need more amount of alcohol to achieve intoxication or the desired effect. They need more alcohol for the effects. This is tolerance. Then the withdrawal symptoms. The symptoms which we will define it later. But whenever the patient try to cut down the alcohol quantity or the frequency, they will develop some kind of symptoms, which is known as a group of symptoms will be developed, which is known as alcohol withdrawal syndrome. And to relieve them, to get relief from those withdrawal symptoms, the patient is usually take alcohol just to avoid those symptoms. So this is pharmacological criteria. The effect of this alcohol use usually depends upon the type of alcohol usage or on the quantity of alcohol preparation which is used. Then we will discuss the types of alcoholic preparations. Can be beer. And these alcoholic preparation, basically, there are the categories according to the alcohol content present in them. Like in beer, in the standard beer, there is 3 to 5% of alcoholic content. In a strong beer, there is 8 to 11% of alcohol content. Then there is wine or fortified wines. In wine, there is 5 to 13% of alcohol content. In fortified wines, there is 14 to 20% of alcoholic content. And in spirits, the maximum alcohol content is present in spirits like whiskey, rum, gin, vodka, or brandy, etc. And this is the most commonly consumed beverage. As you can see in the picture, spirits are the most commonly used alcohol preparation by current alcohol users. Now, the effect of alcohol is basically, you all know, it seems like alcohol is a stimulant with the effects, but alcohol is a CNS depressant. It will start showing effects in around 15 minutes, and those effects reaches its peak in around 30 to 60 minutes on consuming alcohol on empty stomach. And there are many factors which can influence the alcohol absorption, like use of soda or the carbonated beverage. It will increase the alcohol absorption. If you're taking it empty stomach, the effect will be more, and food usually decreases the alcohol absorption. It is more in females. The peak achieved is 20% higher than males, and it's higher in with more body weight. The reason could be decrease amount of water content. That is why the peak achieved achieved in 20% higher in women and in fatty people. If we talk about the psychological effects or the physical effects of alcohol, basically it depends upon the quantity of alcohol consumed. One standard drink of alcohol, that is 30 ml of the spirits, it basically causes blood alcohol concentration will be 30 mg per dl, which is the legal limit. And for legal intoxication, it requires blood alcohol concentration up to 80 to 100 mg per dl. And the effects start coming on with a BAC of 20 to 30 mg per dl. With BAC 20 to 30 mg per dl, you will start having behavioral, cognitive, psychomotor changes. With BAC less than 80, you will start having euphoria, a feeling of relaxation, a feeling of happiness. The patients start talking freely. There will be clumsy movements of hands and legs. There will be reduced alertness. With the BAC 80 to 100, there will be impaired judgment, impaired driving ability. There will be noisy. The patient will become moody. With 100 to 200 BAC, there will be blurred vision, unsteady gait, gross motor incoordination will be there. There will be slurry speech. The patient becomes aggressive. They become quarrelsome. They will talk loudly. With the BAC between 100 to 200 mg per dl. With BAC 200 to 300, there will be a state of amnesia, which we usually call as a blackout. And patient will forget the events occurred during intoxication. If the patient having alcohol and the BAC reaches to 200 to 300 on the last night, then he will forget what happened at that time. He will totally forget the events. Then with BAC 300 to 350, or with almost if the patient is taking 6 standard drinks, they can be a state of coma. And in cases of overdoses, that is 355 or more than 600 BAC, it can contribute to death. And these are the cases. In the cases of overdoses, we can't treat them in OPDs or IPDs. We have to refer them to higher centers. Then the physical effects, they can be gastrointestinal effects. The alcohol, basically in small amount, it can increase the appetite. With the long-term usage, the appetite will be reduced. But initially, alcohol will behave as an appetizer. It can cause gastritis. It can be a cause of nausea and vomiting. There can be esophageal reflux. There can be gastrointestinal bleeding with the long usage. In cardiovascular effects, you will get decreased BP. Hypotension will be there with small or large amount of alcohol. In moderate doses, it can increase BP. It can cause hypertension. There will be warm, flushed skin after alcohol use. There will be loss of heat. The patient will be hypothermic. He will feel chilly. The alcohol usually produce vasodilation. Then the respiratory effects, it acts as a stimulant in small or moderate doses, but in large doses, it can cause respiratory depression. It can be a cause of aspiration pneumonia. In musculoskeletal effects, it can cause muscular pains. There can be weakness, especially in the lower limbs. There can be myopathy. In renal effects, it can cause diuresis. In long-term usage, it can cause renal failure, or in acute effects, it can cause renal failure if the amount is large. So these are the physical effects, acute physical effects. Then the alcohol withdrawal. The characteristic clinical syndrome, as I've already told you, that after abrupt cessation of alcohol use that was heavy and prolonged in past, there is development of some characteristic symptoms, which typically begins around within 6 to 12 hours after stopping that alcohol use. These symptoms are known as alcohol withdrawal symptoms, or the group of symptoms is known as alcohol withdrawal syndrome. The time course and acute withdrawal syndrome is simple withdrawal symptoms basically start within 6 to 24 hours after the last drink. Then they reach the peak in 24 to 48 hours. And typically they will start disappearing within a week. There are chances to develop seizures after the last drink in 12 to 18 hours. So we have to keep in mind, we have to keep the patient under observation, and we have to see if there is something, the start of seizures, or we have to keep the patient under observation for these symptoms, because these are the acute states, and we have to refer the patient to the higher centers. If the patient start developing hallucinations, it can be tactile, it can be visual, it can be auditory. They will start developing hallucinations within 12 to 24 hours after stopping alcohol and after the last drink. And these These hallucinations are basically symptoms which can lead to delirium tremens. So we have to take care of the patient in this phase, because the patient can get into delirium tremens, which is an emergency, which require emergency treatment. So we have to take care of these patients if the patient is developing this hallucinations. These are the alcohol withdrawal symptoms. What are the symptoms which can be developed after stopping alcohol? These are the commonly seen symptoms. After stopping alcohol within 6 to 12 hours, the patient can develop severe anxiety, restlessness, can be sweating, usually cold sweat. There can be tachycardia. The patient can develop fine tremors, which you can ask the patient to extend their arms, and you can see fine tremors in the fingers, which you can differentiate from Parkinson or from hypothyroidism tremors. These are fine tremors. Insomnia will be there. They can be the patient can complain of vivid dreams. There will be decreased appetite. There can be nausea, vomiting, seizures can be there. And in the late withdrawals, you can have delirium tremors, coarse tremors. The patient will be seems to be confused. There is a state of disorientation, psychomotor agitation. There will be autonomic hyperactivity can be seen. There can be tachycardia, hypertension will be there. The patient usually there is paroxysmal sweating, tachypnea can be there, illusions can be there, hallucinations can be there, seizures may occur, and it can turn into delirium tremens, which which needs immediate treatment. Now, the component of treatment, as I said, that it is a behavioral disorder which is affecting physical, psychological, social, and almost every sphere of the patient. And in aphorism 1, Dr. Henneman mentioned that the physician high and only mission is to restore the sick to health, to cure, as it is termed. And what is health? Health is state of well-being at mental, physical, social, and spiritual sphere, not merely an absence of disease or infirmity. So in this case, you have to touch each and every component related to the patient, because every sphere is disturbed. We have to provide the patient a holistic treatment. We have to work upon each sphere, because the patient is emotionally disturbed. He or she may have lost the emotional support from the family. There is no connection, no emotional connection with their family. Their interpersonal disturbances were there. They are usually lost their jobs, so they lost their financial support. The most important, they have lost the trust of the family, of the society. They are aimless. So medical treatment, yes, it should be there. But with the medical treatment, with the homeopathic treatment, we have to work upon the family. We have to motivate the family. We should try to, rehabilitate the patient. We have to give psychosocial treatment. We have to give spiritual treatment. Recreational activities should be there. We have to work upon each and every component. Because if in the phase of withdrawals, you treat the withdrawal symptoms, but the patient have to get back to their family. The cause will be there. That environment we have to treat. We have to remove the maintaining cause or the exciting cause, which can be there in the family itself. So we have to counsel the patient in that way. Along with the homeopathic treatment, we have to counsel the family. We should try to rehabilitate the patient. We should try to give the patient holistic treatment. The role and scope of homeopathy. This is the first and foremost thing where homeopathy can be helpful. The management of withdrawal symptoms under strict supervision of psychiatric or trained homeopathic physician is known as detoxification. So when we treat these withdrawal symptoms, the process is known as detoxification. And these withdrawal symptoms is the initial phase where we have to give maximum support to the patient, because this is the only phase where we can prevent the relapses. Most of the cases relapse because of these withdrawal symptoms. Homeopathic system of medicine is highly useful in the management of withdrawal symptoms of different substances, drugs, including alcohol. But the limitation is, for prescribing homeopathic remedies, we need a picture of disease. We need the perceptible signs of symptoms, which we can get from the patient himself, or by the family, by the relatives, or which we can ourselves observe. But in OPD, we have to, we usually don't get these symptoms, these patients. Most of the drug addicts don't come to our OPD to get treatment for these withdrawals, because none of the substance user or the alcohol user think that they need treatment. Not even 1%. They don't accept that it is a disease. Most of them are in a denial state. They won't accept they are using it in such a larger amount. So which is important, the state of denial is very important behavioral sign of an addict. Usually in the OPDs, the family members visit to your clinic. They will ask medicines for their relatives or for their family members. And with the Mental Health Care Act 2017, even forceful admissions to the de-addiction centers comes to an end. Also, if the family consult you for their family member or for the relatives, it is very difficult to get the pure picture of the disease. How we will individualize the case? Individualization is the basic core of homeopathy. How we will prescribe without individualizing a case? Because family can give you some symptoms, but they are very over anxious. They can be under the fear or the guilt or grief. The picture will be incomplete. We won't get the pure picture of the disease. In that case, our role is to just counsel the family, motivate them, make them aware about the de-addiction centers where these cases can be treatable, where we can meet the patient and we can get these individualizing features to prescribe the similar. That can be helpful. Now, role and scope of homeopathy, we can in short-term management, we can manage the hangovers. We have a lot of remedies like Nux vomica, the topmost remedy used for hangovers and with effective results. We can use Nux vomica, we can use pulsatilla, carboveg, if there are gastric symptoms, antim argentum nitricum, antim tart, we can use China, we can use. In the withdrawal symptoms, we can use remedies. And in the day-to-day illness of the patient, because these patients, because of this abuse, they are immunocompromised. They can have a lot of gastric issues. They can have muscular pains or the acute effects, which we have already discussed. They can come to you for these complaints, which you can treat easily with the homeopathic remedies. In our organon of medicines, there were treatment guidelines mentioned by our master, Dr. Henneman. In aphorism 221, he mentioned, if, however, insanity or mania caused by fright, vexation, and abuse of spirituous liquor have suddenly broken out as an acute disease, so in a withdrawal state, which is an acute problem, in the patient ordinary calm state, in that it is because of the internal sora, and in that case you have to treat these cases or the phase of withdrawal with in acute manner. It should not be immediately treated with antisoric remedies. So in the first place, during the withdrawal symptoms, you can manage the case in acute prescription with the help of proved medicines like aconite, belladonna, stramonium, hyoscyamus, mercury, etc. in highly potentized minute homeopathic doses, in order to subdue it so far that the sora shall be time revert to its former latent state, wherein the patient appears as if quite well. So at the first stage, in the withdrawal state, you can treat the patient with the acute remedies by making acute totality. After that, in aphorism 222, Dr. Hanneman mentioned that the patients who have recovered from an acute mental or emotional disease by the use of these non-antisoric remedies or by the acute remedies, it should not be regarded as cure. So for the long-term management, for prevention of relapses, for reducing the craving, for the post-withdrawal state, no time should be lost in attempting to free him completely by means of prolonged antisoric treatment. So the withdrawal state should be treated with the acute medicine followed by antisoric remedies or the constitutional treatment for the post-withdrawal state. Then in aphorism 226, it is only such emotional diseases as these which were first engendered and subsequently kept up by the mind itself, that while they are yet recent and before they have made very great inroads on the corporeal state by means of psychical remedies such as display of confidence, friendly exhortations, sensible advice, and often by a well-disguised deception, be rapidly changed into a healthy state of mind. So with the homeopathic treatment, you have to give proper counseling to the patient and to the family. This is one of the case of chronic alcoholism in the withdrawal state. A patient aged 48 years who was dependent since 28 years, and there is no history of abuse of other drugs. The patient is complaining of tremors in hands, sleeplessness, weakness, physical generals were decreased appetite, there's loss of sleep, insomnia was there, The patient desires for spicy. Perspiration was more on forehead and the thermals were chilly. The patient mentally was fastidious and there is suppressed anger. On repertorizing the case, on examination, the pulse rate was rapid, steady pulse, and BP was high with the systolic BP was high, 160 by 70 mmHg. And in the past history, there was a history of head injury in 2017 because of this alcohol use. On repertorizing the case, there were remedies, arsenic, nux vomica, sulfur, which were coming after repertorization, while repertorization. And because the patient has desire for spicy food, the patient is chilly, there was no such anxiety or fear with the patient. So I selected nux vomica and I prescribed nux vomica 30 BD for 3 days. On the next follow-up, next day, the patient was better. The tremors were reduced and there was sleeplessness, which is same, but BP was coming down to 140 by 90. The next remedy, I have prescribed nux vomica 200, 1 dose with the Califos 6x, 4 tabs at night at bedtime. In the next day follow-up, the patient was better, sleep was better, tremors were reduced, and the BP came down to 130/88. And so the next remedy, Califos 6x, was continued for the at night at bedtime. So the patient was recovered with nux vomica. There were 4 studies I have identified on substance use disorder. There are total 8 studies I have identified with substance use disorders. And 4 studies were done on alcohol, which really shows effectiveness of homeopathy with these alcohol use disorders. And the topmost and the medicine that is very common in all the studies were nux vomica, arsenic, and sulfur. These are the constant remedies which have shown very good results in these cases, especially alcohol cases. So in this case also, nux vomica has given a very nice results. And in the addiction center where I worked, nux vomica is the very beneficial remedies to be used in such cases. In the second case, the patient was aged 42 years with alcohol dependence since 15 years with multiple relapses. Presenting complaint was injury on upper lip with ulceration. There were palpitations, which is aggravated in the evening. There was sleeplessness, insomnia was there, desire for salty, perspiration scanty, thermals were chilly. On examination, pulse rate was found to be 92 per minute. BP was again high. In this alcohol patients, usually the BP will be high. They are hypertensive because of the alcohol. This is the acute effect. 170 by 100. BP was there. And in the past history, I got that the father and brother both were alcoholic. On the basis of this history of alcoholism in the family, the BP was high, there were palpitations in the evening. So the injury with ulceration, I prescribed Ciflinum 200, 1 dose. On the next day follow-up, there were no new complaints. I've given calendula to be applied for the injury, and there were no new complaints. Sleep was good, and the pulse rate was 84 per minute. BP also came down to 140 by 90 mmHg on the next day, and I have prescribed nothing. I have given the case was followed by SL for the next day also, and the next follow-up, the BP came down to normal, that is 130 by 80 mmHg. The pulse rate was also normal. On repertorizing the common symptoms of withdrawals of alcohol, like tremors, like headache, like nausea, vomiting, and agitation, hallucinations, anxiety. These are the remedies: arsenic, sulfur, pulsatilla, aconite, china. cocculus, lachesis, entimtar. These are the common remedies which are covering the alcoholic withdrawal syndrome symptoms. These can be thought of when there are alcohol withdrawal symptoms in a case.
Doctor, it is time is 8:45. So
Okay.
we can conclude the session within 2 minutes, and we can have a discussion.
Okay, sir. So in the long
You
term,
can,
if yes,
you can present some more cases in the coming presentation,
okay,
if possible.
okay, sure, sir. So in the long-term effects, I have already told you gastrointestinal, they can be fatty liver, the liver, alcohol affects the liver, fatty liver, alcoholic hepatitis can be there, cirrhosis, nutritional deficiencies will be there, then hematological anemia will be there. Cardiomyopathy, hypertension, you can get into these cases. Korsakoff syndrome can be there. Dementia can be there. You can found that the patient have stopped taking alcohol a long time back, and then a patient coming to you for this dementia thing. So it is very common in alcoholic patient. If you get into the history, you can find that the patient is alcoholic in the past. So you can treat it in that way. Cancers are common in alcoholic patients. There is ketoacidosis, hypocalcemia, hypomagnesemia, hypoglycemia can be there, and they can be miscellaneous disease condition like psoriasis. Tinea is very common in such conditions because they are very disorganized, or they live very unhygienic life. Then these are some medicines. Sulfur 30, 200 is given in prescriber for the alcohol habit, which can you can give single dose of sulfur 30 or 200 every 2 or 3 weeks to the alcoholic patient to reduce their craving. You can use China Q for reducing or to relieve the craving of alcohol. Then if there is whirling vertigo is there is growing at stomach pit, you can use Quercus. If there is sinking sensation, Avena sativa for the weakness, nervous weakness or nervous collapse in alcoholic patient, or for reducing the craving, you can use Avena sativa or Strephenthus Q, which gave very good results in such cases. Then for Nux vomica is a very common remedies, and if there is irritability with nervous depression, you can use Avena sativa. Zinc is a very good remedy for the trembling of lower limbs or for the irritability or in alcoholic patient. If there is vomiting, nausea, vomiting, and the tongue is white, you can give entimtar to the patient to relieve the patient from those symptoms. You can use Quercus Q in all drunkards. Common sign and symptoms you can get is insomnia, increased perspiration. Then tremors will be there. For external tremors, you can use agaricus, which is a beautiful remedy for these tremors. Calibrom can be used for the trembling of hands. You can use zincum for the trembling of lower limbs, and phosphorus if the whole body trembles. And in internal trembling, where the patient is complaining of trembling, but you cannot see it externally. In those cases, sulfuric acid gave marvelous results. Then if the patient feels chilly after abuse of alcohol, you can use Ledum and Nux vomica. For insomnia, you can use a number of remedies that I've mentioned in our repertories. After getting the totality of symptoms, you can use Califos is a very wonderful remedy for such cases. Nux vomica is very useful in those cases, and also the passiflora and other remedies. The patient usually they are very disorganized, they are very unhygienic, so they have aversion to bathing. So in those cases, you can repertorize the case. They are common medicines which can be used like sulfur, antimcrude, soranum, rustox, sepia. The patients, the addicts are usually indifferent to the family members, to the society. They have their own sphere. So the indifference is very marked in such in such drug addicts. Suicidal tendencies are there. If you are not allowing them to take alcohol or other drug substance, they will get into these suicidal tendencies. But they lack courage. They won't commit suicide. They do it to give you that sense, yes, allow me to drink. mode. So we have remedies, we have this is the only science which give consideration, which consider mental symptoms while treating a case. We are not prescribing only on the basis of physical symptoms. We always consider mental symptoms with the physical symptoms, and on that basis, on the totality of the symptoms, we prescribe remedies. So this is the wonderful science which can be used in such cases. Restlessness, for the restlessness we can give medicines. There are most common illnesses like body aches, cramp will be there in these cases. Hyperacidity, they usually complain of hyperacidity. There is constipation, there is diarrhea, there can be dropsy after stoppage of alcohol or with the use of alcohol. Then medical treatment, there is no single system of medicine which effectively treat SUD patients. Therefore, best practices of all the systems must be combined for better output. So it is not like we have to stick to homeopathy. If there is any emergency, you can refer it to the higher centers, or you can give allopathic remedies or whatever treatment the patient need in that phase. There are some behavioral symptoms which are very much common in these addicts, like they are very abusive, and we have remedies for this abusive nature during drunkenness, abusive nature towards the family, or if the patient is insulting their parents, we have these medicines differentiated in the differentiated form in our repertories. So we can have, we should be aware of all these rubrics so that we can use them, or we can help them with these medicines to the patient. They are holding a guilt. They are very disorganized. They blame others. For every situation, they blame others. They have stealing. They steal things to buy that alcohol. They are jobless. They have to steal to get that alcohol. They are very careless. They are telling a lie every time. They are breaking house rules. They are stubborn. Stubbornness is there. They threat people to get alcohol. They defend themselves. They give up. They are aimless. They are having their own way. There is hindrance in the treatment. They won't allow you to give medicine or take medicines. They are manipulative. They have negative contact. They have negative support. They are not following directions.
Doctor, we can conclude now, and we can have another session about the same thing, the same subject, so that you can give more and more explanation to all these things. As we have in Kerala, we have government at government hospital. There are de-addiction centers with homeopathic medicines. Where we utilize the services of counselors and allopathic doctors for support, and even psychiatrists are assisting homeopathic doctors in our hospitals, and we have wonderful result getting from this kind of chronic alcoholism. So let us begin the discussion with our beloved Mridul Kumar Sahani sir from.
Dr. Ganesh, and thank you, Dr. Shwetha. It was nice listening to you again and again, and I have observed so many beautiful things that you have made in explaining all these things. What I like to add regarding the removing the habit of the drinking, that this alcohol, there are wonderful rubrics added in the radar synthesis, and that is the Angelica atropipra. Then another medicine is Bufo. Another medicine is Syncona Siculorova, Pola, Curicus. Then again Curicus, Robur, and then Strontia F, Strontia N, and sulfuric acid and sulfur. I hope these medicines can be added and can be tried out, because I have it is very difficult to remove the habit of the habit. But with the homeopathic approach, we can do it. This is possible. And as Dr. Dhanis was telling, it is also working with the hospitals, and they have found a very good results. So I feel in our practice also, I feel that it is very good. So thank you, Shwetha, for coming, and bless you for your very good presentations. Keep coming to our session, and thank you all.
Thank you so much, sir. You're muted, sir.
Yes, thank you, Sahani sir. If anyone want to have a chat with Dr. Shwetha Singh, you can raise your hand so that we can allow you to unmute. Anyway, this is one of the best area where homeopathic doctors can do wonders. That's the reason why in Kerala, every district we have such centers, and the eminent doctors are doing wonderful job in getting people back to life. And that is something unexpected, because homeopathy is supposed to be, most of the people believe that homeopathy is still for children's diseases, but frankly, it is not so. So that's what I would like to add to your presentation. You have covered almost all part of the alcoholic problems. So because what are the causes for the alcoholism? What are the type of alcohols used by people, and how it works on everyone, and what are the symptoms produced after taking this alcohol, and what are the medicines are supposed to be delivered by homeopathic doctor, and even you have advised some of the medicine for withdrawal effect also, for the purpose of withdrawal. So all these things in a 1 hour, just like a one-day cricket, you have shown that this subject can be covered within such a short time. It's not not a small thing; it's a big thing indeed. And if anyone want to have, I think some of the people, Dr. Boblim, you want to comment on this? Shen, come out. Dr. Boblim from Malaysia is there, and he is always an active participant of us. Dr. Boblim, are you there? Please unmute yourself. I am very Dr. Hariharan sir, are you there? Please. Please. Yes. Yes, Boblim, doctor.
Okay, sorry. Okay, that was a very, very detailed explanation on alcoholism by Dr. Shwetha Singh. Thank you very much for the wonderful information, because even in our country, there are certain people who have a certain level of alcoholism. And what is the, but sometimes they don't have this serious, like this what do you call that, withdrawal symptom or whatever, but there is still a craving. When I have a friend, she was asking me whether I can bring a bottle of whiskey for her, and her physical symptoms are like she's diabetes, having high blood pressure, and obesity. So can Dr. Shwetha Singh or some of you suggest what should be the remedy to help her?
Sir, actually, withdrawal symptoms only develop after abrupt cessation of alcohol intake. If the patient is continuing with the alcohol use, then these withdrawals will not develop. The condition is only after the patient stopped taking alcohol. And if he or she is taking alcohol in a continuous manner, then they will develop symptom. They will again take alcohol. Then the symptoms will that alcohol actually relieves that withdrawal. In that case, yes, we have to counsel the patient in that case, because this is a cycle. Whenever patients stop drinking, they will start developing these withdrawals. And to get relief from this withdrawal, the patient again start drinking. So this is
Alright.
a cycle, and this is basically withdrawal, which we have in the diagnostic criteria, pharmacological. So in
Okay.
that case, the counseling is very important, and
Oh, so
obviously,
what about the
yes,
cure for the this one alcoholism?
Yes, sir.
and to reduce the alcohol craving, we can use China Q, we can use Strophanthus, we can use Quercus, we can use Nux vomica, and for this for reducing the craving, we have a lot of remedies. We have to see the patient, the constitutional state, we have to make the totality, and on the basis of that, we have to select a simillimum. After that, we can reduce the craving. There is
Yes, I was
no
thinking about this.
shortcut
Okay.
formula for
The
that.
magnesium and the consistent remedy. Okay, thank you very much. Thank you,
Okay.
Dr. Danish, for giving me a chance to
And
start.
now it is up to Dr. Deepthi Gilla. She's also working as a research fellow at CCR, so National Institute of Homeopathy. Yes. And yes, doctor, you can have a chat with Dr. Shwetha Singh, and you can also say the vote of thanks to the session. Yes, Dr. Deepthi Gilla.
Good evening, sir. Good evening, Dr. Shwetha. That was a wonderful presentation. I just wanted to know from you whether you're giving any centesimal potencies of the tinctures that you have mentioned, like Strophanthus terpulea, Quercus angelica, and all, or only mother tinctures are used, or 6C, 30C, 200 are also given.
For the China, I use 30, 200 also, ma'am. And yes, Strophanthus, Quercus, Avena, I have used it in mother tincture forms.
Okay. Another question is, are you using any assessment measures like severity of alcohol dependence questionnaire or SIVA AR for withdrawal symptoms, audit questionnaire, or cage questionnaire or something like that? Because since you're doing such a wonderful work on it, I think it would be better if you can measure it quantitatively and publish such articles. That would be, useful to many others. To, in the scientific world also, we can
Absolutely,
demonstrate
ma'am.
the usefulness of homeopathy in ADS. Yeah, that's all.
Actually, thank you so much, ma'am. Actually, I was working with this de-addiction center, and I'm associated with the CCRH since 1 year, 1.5 year. So I am learning with these scales and all. This is my work before I, joined this CCRH, and now I have seen those scales and all. We are also working on other substance in the de-addiction centers, and hopefully I'll be working more about the scaling and with the measurement scales. I would like to present in my next presentation.
Yeah, that's great. All the best, Doctor.
Thank you so much, ma'am.
Thank you, sir.
So you are muted.
Yes, Dr. Deepthi Gilla, you can say the vote of thanks to Dr. Shwetha Singh.
Thank you so much, Dr. Shwetha Singh. It's really an interesting and an informative session, and wish you all the best for your future endeavors. Thank you, IFPH, for the persistent continuing webinars and spreading the utility of homeopathy in several clinical conditions in a very widespread manner. Thank you all for attending. Thank you so much, and good night.
Thank you, Dr. Deepthi Gilla. Tomorrow we will have a session from Dr. Jitesh Sharma, and he's talking about the A to Z clinical material. So something special for homeopathic doctors. So with that, we come to the end of the session, and this Dr. Shwetha Singh, do you want to say anything?
Thank you, sir. Thank you for this opportunity. And I'm hopeful that I will work more on the substance use disorder, and I have I'll try to give my best work endeavors on this subject.
Thank you, Doctor. And now it is up to Dr. Shaila to continue with the Malayalam session.